Now with that warning for parents about using drugs like Benadryl to help your babies go to sleep. Connecticut is now issuing a public health alert linking at least 4 recent deaths of children to these drugs. And our senior medical contributor, Dr. Jennifer Ashton, is here with us. And Doc, most people associate Benadryl with allergy season, but you know, what should we know about it as a sedative?
Well, this is a drug we use all the time in the hospital. Of course, it's available over the counter. The brand name is Benadryl. The generic is diphenhydramine. It has its benefits as an antihistamine, but it's also a very strong sedative. And like any drug, it has its risks. When you talk about the risks of Benadryl, you're talking about respiratory depression or breathing problems with potentially high doses, a rare but potentially fatal abnormal heart rhythm, and then like any medication, especially over the counter, there is the chance for improper dosing, especially when you're talking about children.
So these deaths make it seem like it's just improper dosing. Parents maybe using a little bit too much, not knowing exactly what to give their child.
Exactly. And in medicine and pediatrics, we have a saying, kids and babies are not just small adults. And when you talk about the medication they're given, it's always dosed based on their body weight. And the smaller the baby, the less margin of error you have for making a dosing error. So that's why we've been hearing warning after warning from the American Academy of Pediatrics about even over-the-counter meds and making sure the right dose is given. So if you take a look at the recommendations specifically for Benadryl and babies under the age of 2, really not recommended. When you're talking about kids ages 2 to 12, then you want to dose based on the weight, and over the age of 12 in general, they can tolerate an adult dose. The most important thing for any caregiver or parent, if you have a question about the dose of this or any medication, check with a pediatrician or pharmacist.
Absolutely. We reached out to Johnson & Johnson, which makes Benadryl, and they told us this. We advise that parents and caregivers only use medicine as labeled and that they talk with their health care provider, as you just said, if they have any questions. So what other tips do you have for parents?
Well, look, we're both parents. Any parent can relate to that frustration or panic that sets in when you want your child to go to sleep, need your child to go to sleep, or they're agitated. I think you have to find what works for you and that child. But I like to take a 5 senses approach. So if you start by what that baby or child is hearing or seeing, maybe a soothing music or video will help. Movement, my daughter would fall out cold if you put her in the car, so a lot of parents are familiar with that. Rocking mechanism or even massage. Warm tea or warm milk can help. But I think the most important thing, Michael, you have to ask why. That in medicine, as in life, don't just put a Band-Aid on something. If your child is agitated or won't sleep, ask why before you start treating it.
What about earplugs?
That works too.
just check it. Doc, thank you so much for all that advice. And parents out there, please listen and protect your children.